When scheduling a new patient, what is the first piece of information the CMAA should verify? A. Insurance coverage. B. Date of birth. C. Full legal name. D. Reason for visit. Answer: C. Verifying the full legal name ensures accurate patient identification and avoids record errors. Which form authorizes the release of patient health information to a third party? A. Consent to treat form. B. HIPAA authorization form. C. Insurance assignment form. D. Intake registration form. Answer: B. A HIPAA authorization form is required for disclosure of patient records outside the healthcare facility. What is the most secure method to transmit confidential patient records? A. Fax machine without cover page. B. Standard email. C. Encrypted electronic portal. D. Regular postal mail. Answer: C. Encrypted portals ensure HIPAA compliance by securing patient health information during transfer. A CMAA receives a call from a patient requesting lab results. What should the assistant do first? A. Read results directly from the chart. B. Forward the call to the provider. C. Ask the patient to come in immediately. D. Deny access to the information. Answer: B. Only the provider can interpret and communicate clinical results to patients. Which action demonstrates compliance with OSHA regulations in a medical office? A. Using labels for biohazard containers. B. Sharing login credentials. C. Storing food in medication refrigerators. D. Keeping sharp containers unlocked. Answer: A. OSHA requires proper labeling and handling of hazardous materials for staff and patient safety. What should a CMAA do if a patient refuses to sign a financial responsibility form? A. Cancel the appointment. B. Document the refusal in the chart. C. Provide services without documentation. D. Ask the provider to sign instead. Answer: B. Documentation of refusal protects the office legally and ensures accurate record keeping. When a provider is running behind schedule, what is the CMAA's best response to waiting patients? A. Ignore the delay. B. Provide an estimated wait time. C. Reschedule all patients. D. Tell patients to leave and return later. Answer: B. Communicating expected wait times maintains professionalism and patient satisfaction. Which is an example of an incidental disclosure under HIPAA? A. Discussing a patient's diagnosis with a coworker in the hallway. B. Sending records to the wrong provider. C. Accidentally leaving patient charts open at the reception desk. D. A patient overhearing their name called in the waiting room. Answer: D. Overheard names are incidental disclosures, which are allowed if reasonable safeguards exist. What must a CMAA verify before scheduling an outpatient procedure? A. Insurance authorization. B. Patient's employment status. C. Pharmacy contact information. D. Family history. Answer: A. Most procedures require prior authorization from insurance for coverage approval. Which filing system is most efficient for a large practice with thousands of records? A. Alphabetical. B. Color-coded numeric. C. Chronological. D. Subject-based. Answer: B. Color-coded numeric filing reduces errors and improves efficiency in large practices. Which type of appointment requires the most scheduling flexibility? A. Routine physical. B. Walk-in urgent visit. C. Follow-up exam. D. Preventive care check. Answer B. Urgent walk-ins need immediate accommodation without disrupting scheduled patients. A patient requests an itemized statement. What should the CMAA provide? A. List of only insurance payments. B. General summary of charges. C. Detailed breakdown of services and charges. D. Copy of medical records. Answer C. An itemized statement shows services, dates, and charges in detail for clarity. Which document explains a patient's financial responsibility after insurance processes a claim? A. Explanation of benefits, EOB. B. HIPAA form. C. Patient registration form. D. Provider schedule. Answer A. The EOB details what insurance paid and what the patient owes. What is the CMAA's role during a patient referral? A. Select a specialist for the patient. B. Submit referral forms and coordinate appointments. C. Interpret test results. D. Approve insurance coverage. Answer B. The CMAA handles paperwork and scheduling to ensure smooth referral processes. A patient arrives late for an appointment. What is the CMAA's best action? A. Refuse to see the patient. B. Inform the provider and reschedule if necessary. C. Place the patient at the front of the line. D. Ask another patient to wait longer. Answer B. Communication with the provider allows appropriate decisions about late arrivals. Which type of scheduling method groups patients with similar needs during a block of time? A. Wave scheduling. B. Open hour scheduling. C. Cluster scheduling. D. Double booking. Answer C. Cluster scheduling improves efficiency by grouping similar procedures. When verifying a patient's insurance eligibility, what information is required? A. Patient's policy number. B. Date of last physical. C. Pharmacy address. D. Medical history. Answer A. Policy number and insurance details confirm active coverage. A CMAA should collect copayments at which time? A. After insurance pays the claim. B. At the time of service. C. Before scheduling an appointment. D. During billing cycle. Answer B. Copays are due at the time of service per most insurance contracts. If a patient refuses treatment, what should the CMAA do? A. Ignore the refusal. B. Continue treatment without consent. C. Ask the family to override. D. Document it in the patient record. Answer D. Documentation of refusal ensures legal and ethical compliance. Which type of appointment requires the most scheduling flexibility? A. Routine physical. B. Walk-in urgent visit. C. Follow-up exam. D. Preventive care check. Answer B. Urgent walk-ins need immediate accommodation without disrupting scheduled patients. Which action protects patient confidentiality at the reception desk? A. Using privacy glass or barriers. B. Calling out full names loudly. C. Discussing diagnoses openly. D. Posting appointment lists publicly. Answer A. Barriers prevent others from overhearing sensitive information. What is the main purpose of a tickler file in a medical office? A. Store lab results. B. Keep financial records. C. File patient complaints. D. Track future tasks and deadlines. Answer D. Tickler files remind staff of upcoming tasks and follow-ups. A patient wants to transfer records to another provider. What should the CMAA request? A. A new insurance card. B. HIPAA-compliant release form. C. Provider's approval. D. Patient's family consent. Answer B. A signed release ensures legal and secure transfer of medical records. When should a CMAA verify patient demographic information? A. Only on the first visit. B. Only after a procedure. C. Every 5 years. D. At every visit. Answer D. Verification at each visit prevents billing errors and ensures accuracy. Which mail type is best for sending time-sensitive legal documents? A. Standard mail. B. Certified mail. C. Bulk mail. D. Medium mail. Answer B. Certified mail provides proof of delivery and is used for important legal or medical documents. What must a CMAA do before scheduling an inpatient admission? A. Confirm operating room availability. B. Review patient's social history. C. Contact the patient's pharmacy. D. Obtain pre-authorization from insurance. Answer D. Insurance pre-authorization is mandatory before hospital admissions. Which is considered a demographic detail for registration? A. Blood pressure. B. Marital status. C. Lab results. D. Diagnosis. Answer B. Marital status is demographic data, unlike medical results. Which is an example of a legal document in the medical office? A. Consent to treat form. B. Greeting cards. C. Appointment reminders. D. Newsletter sign-up. Answer A. Consent forms are legally binding and protect both patient and provider. If a patient calls to cancel an appointment, what should the CMAA do? A. Erase it from the schedule without note. B. Document the cancellation and reschedule if needed. C. Refuse to cancel. D. Tell the provider immediately without record. Answer B. Proper documentation ensures accurate records and provider awareness. What does the abbreviation NPI stand for in healthcare administration? A. National Provider Identifier. B. New patient intake. C. Nursing practice instruction. D. Numbered patient information. Answer A. NPI is a 10-digit number assigned to providers for identification in billing systems. When verifying new insurance coverage, what should the CMAA confirm first? A. Copayment amount. B. Policy effective date. C. Pharmacy preference. D. Patient's mailing address. Answer B. The effective date ensures the patient's insurance is active and valid. Which scheduling method allows multiple patients to be booked for the same time slot? A. Stream scheduling. B. Wave scheduling. C. Modified block scheduling. D. Sequential scheduling. Answer B. Wave scheduling books several patients at the same time to be seen in order of arrival. If a provider asks for the day's patient roster, what should the CMAA provide? A. Superbills. B. Encounter forms. C. Daily appointment schedule. D. Billing codes. Answer C. A daily appointment schedule lists all patients, times, and visit types. What is the purpose of assigning CPT codes in medical administration? A. Track insurance carriers. B. Identify medical procedures and services. C. Document demographics. D. Measure provider productivity only. Answer B. CPT codes describe services performed and are used for accurate billing. What should the CMAA do when a patient presents with a new insurance card? A. File it without action. B. Ask the provider to review it. C. Wait until billing cycle. D. Update the patient's electronic health record immediately. Answer D. Updating records promptly prevents billing errors and claim denials. Which document must be signed to acknowledge a patient's understanding of office policies? A. Advance Directive. B. Notice of Privacy Practices, NPP. C. Informed Consent Form. D. Treatment Authorization. Answer B. The NPP explains how health information will be used, and acknowledgement is required. A CMAA receives a call from a pharmacy about a prescription refill. What should be done first? A. Provide approval immediately. B. Refuse the request. C. Ask the patient directly. D. Document the request and forward it to the provider. Answer D. Only the provider can authorize refills. The CMAA must document and relay the message. Which insurance plan requires a referral from a primary care provider to see a specialist? A. PPO. B. HMO. C. POS. D. Indemnity. Answer B. HMOs require primary care referrals for specialty services to control costs. Which is the safest way to correct an error in a patient's paper chart? A. Erase the mistake. B. Use correction fluid. C. Draw a single line through it, initial, and date. D. Tear out the page and rewrite. Answer C. Errors must be crossed out with one line and initialed to maintain a legal record. What is the purpose of a superbill? A. Track patient demographics. B. Provide a financial estimate. C. List procedures, diagnoses, and charges for billing. D. Record only insurance payments. Answer C. A superbill includes procedure and diagnosis codes used to generate insurance claims. Which scheduling system is best for managing patients who need same-day urgent visits? A. Open access scheduling. B. Double booking. C. Time-specific appointments. D. Clustering. Answer A. Open access allows patients to be seen the same day, improving urgent care flexibility. What should a CMAA do if a patient is angry about a long wait time? A. Ignore the complaint. B. Explain the delay politely and offer rescheduling if necessary. C. Ask the patient to calm down or leave. D. Tell the provider immediately without speaking to the patient. Answer B. Addressing concerns respectfully improves patient relations and professionalism. When is an advance directive typically collected? A. Before any major surgery or hospital admission. B. During every outpatient visit. C. Only when requested by insurance. D. After treatment ends. Answer A. Advance directives are reviewed before major procedures to document patient wishes. A CMAA notices a patient's insurance card has expired. What should be done? A. Accept it anyway. B. Ask for updated insurance information. C. Bill the old insurance provider. D. Refuse care. Answer B. Updated insurance prevents claim denial and ensures accurate billing. Which federal agency enforces HIPAA regulations? A. OSHA. B. CMS. C. FDA. D. HHS Office for Civil Rights. Answer: D. The HHS Office for Civil Rights investigates and enforces HIPAA compliance. When scheduling diagnostic testing, what should the CMAA confirm with the patient first? A. Whether they want to use cash. B. Their preparation instructions and availability. C. Their family history. D. Their favorite lab location. Answer: B. Confirming instructions and scheduling ensures patient readiness and compliance. What should a CMAA do when receiving a check payment by mail? A. Deposit it without logging. B. Shred it if it looks old. C. Record it in the payment ledger before processing. D. Forward it directly to the provider. Answer: C. Payments must be documented in the ledger for accurate financial tracking. Which part of the patient chart includes allergies, medications, and past surgeries? A. Demographics. B. Medical history. C. Financial records. D. Insurance section. Answer: B. Medical history contains allergies, medications, and surgical background for clinical reference. A CMAA is tasked with managing recall appointments. What is the purpose of these? A. Collecting outstanding balances. B. Informing patients about lab delays. C. Marketing new services. D. Following up on preventive or routine care. Answer: D. Recall appointments ensure patients return for ongoing or preventive care needs. What is the proper action if a patient requests their medical records? A. Refuse due to confidentiality. B. Provide access after assigned release and processing time. C. Give the entire chart immediately. D. Require insurance approval first. Answer: B. Patients have a legal right to access their records after completing required authorization.